Immediate dentures and RPDs share similar data collection principles. Depending on patient's clinical condition, 2 primary treatment pathways and 3 workflows are available. Use the flowchart to identify the appropriate workflow. Each workflow links to a step-by-step guide with short education videos explaining every stage of the process. The first workflow is intraoral scan only workflow. This workflow only requires intraoral scan, no need for impressions. It is recommended when the patient has enough remaining teeth to maintain a stable occlusion, and intraoral scan can accurately capture all remaining teeth and require soft tissue anatomy. RPDs are typically supported by both teeth and soft tissue. RPD that can be made using this workflow has to be: first, the RPD is mainly supported with limited edentulous areas. Functional border molding is usually not required. Second, the edentulous area should have sufficient keratinized tissue that can be accurately captured by intraoral scanning. 3. Patient's remaining dentation can maintain a stable occlusal relationship. Immediate dentures are supported entirely by soft tissue. Therefore, accurate tissue adaptation and well-sealed functional border are critical for retention. Intraoral scan alone cannot reliably capture functional border for immediate dentures. However, because immediate dentures are provisional, intraoral scanning may still be used initially. Border sealing can be temporarily established by adding reline material to the denture base following extractions. As healing and bone resorption occurs, retention will gradually decrease. After about 6 months, when extraction site is healed, patients typically require one of the following. They will need new complete dentures. The immediate dentures can be used to take a final impression, capture functional borders, and accurate tissue anatomy. You can follow duplicate denture with impression workflow to make these new complete dentures. Or they need chairside hard reline to improve tissue adaptation and functional border seal. Therefore, as long as the patient has adequate keratinized tissue for reliable scanning and sufficient remaining teeth to maintain a stable occlusal relationship, the intraoral scan only workflow can be used for the immediate dentures. When intraoral scan alone is not enough, we need to add impression. This pathway is recommended when the RPD relies heavily on soft tissue support and accurate functional border are essential, or the arch lacks sufficient keratinized tissue and the non-keratinized tissue cannot be reliably captured by intraoral scan alone, or the patient does not have enough remaining teeth to maintain a stable occlusal relationship, requiring wax rim to record the bite. In traditional workflows, an alternate impression is taken to produce a study model, followed by fabrication of custom tray, a final impression, and wax rims to record the maxillary-mandibular relationship. This process typically requires multiple visits. To reduce the number of visits and make the work easier, 2 impression-based digital workflows are introduced here. If the patient has an existing RPD, it can be used to assist in obtaining impression. You will use intraoral scan plus impression with existing RPD workflow. When no existing RPD is available, modified Easdent tray can be used to capture accurate soft tissue anatomy and functional borders. You will use intraoral scan plus impression with Easdent tray workflow. Existing RPDs or Easdent tray may serve as bite blocks to record centric relation at the appropriate vertical dimension of occlusion and to facilitate scanning the correct bite relationship. Scans of the impression provide accurate tissue anatomy and functional border information. They can also provide valuable aesthetic reference for the lab to set up the teeth. Intraoral scans are still very important, as they provide high accurate 3-dimensional data of the remaining teeth. lab can merge intraoral scan with impression scan to create accurate digital models that combine precise tooth anatomy with accurate soft tissue contours. Using these combined workflows, or you can call them digital AutoCAD techniques, clinicians can capture tissue anatomy, function border, bite relationship, and aesthetic information in a single visit, reducing chairside time, minimizing the number of appointments, and enable delivery of RPDs or immediate dentures in as few as 2 visits.